So somebody asked me a question today, so I thought that I would answer that here. The question was, what causes bunions? There are a number of things that can cause bunions, but basically they all sort of stem from the same problem. So basically, the foot is a tripod. It's designed to be a tripod. And the tripod is made up of the little toe, the big toe, and then the heel. So there are supposed to be two arches, one between the big toe and the heel, and then there's also supposed to be an arch across the middle of the foot from medial to lateral, or from side to side, which is the big toe to the little toe. So basically, you're supposed to have 3 points of contact, and this is the way that the foot is designed to be. So when you have hallux valgus, you now have this most medial front point of the tripod is pushed over. And this can be from a number of, this can be because of a number of reasons. So you can have a flat foot with an arch, so or with a lack of an arch, pardon me, so that the foot kind of rolls over like this. So this is called pronation. And when the foot does that, you actually end up having a lot of force, or receiving a lot of force on the side of the big toe. So as you have a flat foot, and as the foot rolls over and you lose this longitudinal arch, the toe gets pushed over. And the more flat your foot goes, or gets, or becomes, the more pressure is on the side of that toe, the more it gets pushed over, and the narrower your tripod becomes. And this ends up precipitating or speeding the progress of your hallux valgus. Okay, so that's one of the causes. You can also have a man-made cause from footwear. So if you wear a lot of narrow shoes, then the shoes themselves can push this part of this being the big toe, they can push this side of the tripod over, and then the tripod again becomes narrower, and as the tripod becomes narrower, it becomes less stable, more likely to roll over when you walk, and then this will also result in precipitation of your hallux valgus and progression of the overall deformity. So that's another cause. And in particular with women, if they wear high heels, so that this first toe here at the MTP joint, which is the metatarsal phalangeal joint, so if it's bent because of the high heels, and the higher the heel, the worse this is, then already you've put this toe at a disadvantage. And then because sexy high heels are also narrow at the front, not only have you bent that joint, but you're pushing it over. So you've really compromised the tripod, and you're making the foot have to work extra hard to maintain this shape. And of course it can't do that, and you eventually make the bunion worse. So that's another cause. You can, of course, have congenital causes, such as some people actually have a larger space in between the two metatarsals. And I know these are metacarpals here because I'm showing you my hand, but imagine this with a foot. The metacarpals, these two bones here, which are proximal to the toes, sometimes people can have abnormal space between those two rays, and because of that, the MTP joint, the first MTP joint, gets pushed out to the side, and then the toe gets pushed back again by our footwear, and so you end up with a hallux valgus. So there are a number of causes, some of which are related to the configuration of the foot, or the appearance of the foot. Some are related to the configuration of the toes themselves, and some have to do with, which are sort of man-made causes, which have to do with footwear and the position that we put our feet in. So anyway, those are several of the typical causes of bunions. And so in order to treat that, it depends on what the particular cause is. So, for example, one of the first things that we'll do when we see patients who have bunions, we'll ask them about what type of footwear they wear, and we'll try to recommend to them, well, we will recommend and try to get them to wear wider footwear, okay? In particular, footwear with a wider toe box, what we call the toe box. That's the part that accommodates the toes. And this will allow the foot to do what it was designed to do. So basically, when you weight bear on your foot is designed to absorb shock. And the way that it does that is by spreading out the points of this tripod. And so when you put weight on the foot, this arch spreads out and this arch spreads out. But if this arch can't do that because of the shoes, then you have a problem. You put more tension on this longitudinal arch and you render this arch ineffective. So if you have a wide toe box shoe which accommodates spread of the toes, then this arch can now spread out and it can accommodate weight like it's supposed to. This arch does its job, and you are less likely to promote the progression of the hallux valgus and the bunion deformity. Okay, so that's the first thing that we do, and you can look for shoes which in particular have a wide toe box, and those shoes, New Balance is one brand that is particularly known for having wide toe box shoes, and you can order shoes with an extra wide toe box, or you can get shoes which are called naturally shaped footwear. And so there's a number of different brands. Two particularly well-known brands are Vivo Barefoot and Lems, L-E-M-S, and we can put a link to that in the description. So those are two brands which have footwear which are shaped like the natural shape of the foot, so they don't impinge on this toe and they don't crowd the toe. So that's the first and easiest treatment, is to change the footwear. Another treatment, which is also a non-operative treatment, but which requires some dedication on the part of the person who's doing it, is to work on strengthening the intrinsic muscles of the foot. So the foot is very rich in terms of nerve endings, and it has a large number of muscles which are within the body of the foot itself, and those muscles are called the intrinsic muscles. And normally in North American society, because we wear shoes most of the time, our intrinsic muscles really don't get that much of a workout because they're held in this shoe which does all of the supporting for the foot. So because of that, these muscles are lazy, and they really have trouble stabilizing the foot once you are no longer wearing footwear. So another thing that you can do, which is a non-operative treatment, is to really work on developing the intrinsic muscles of the foot. So this means being out of your feet or out of your footwear as often as possible, and really doing exercises to work to strengthen and learn the control of the intrinsic muscles of the foot. So the muscles that flex and extend the toes, the muscles that shorten the foot, lengthen the foot, dorsiflex the ankle, and plantar flex the foot. Those are actually extrinsic muscles because they're outside of the foot. But to work on all of these movements, because this will allow you to have better control of the foot, and it will help to increase the muscle tone within the foot, which will help it to be more resistant to this deformity. Third thing that you can do, which is a non-operative treatment, is to either use a silicone spacer in between the first and the second toes, particularly when you sleep at night, but you can also use it for activity during the day, or you may use a brace for which will help to correct the deformity for use when you sleep. So these are all non-operative treatments for hallux valgus. Now, if these things prove to be ineffective, or you have a more significant bunion deformity from the hallux valgus, then you may require some kind of operative treatment. And there are quite a few treatments for hallux valgus, and they are dependent on what your particular problem is and what is the severity of that problem. But basically, there are similar components to each of these different procedures. So for each of these procedures, basically what we're going to work on doing, we make an incision here along the side of the first metatarsal phalangeal joint, and that's where the bunion is. We would do a bunionectomy, which means that we are going to cut off the bump that is proud here at that joint, and then we are going to correct whatever other deformity is present within the foot, which is causing this bunion to form. So, for example, if there is an increased angle between the two first and second metatarsals, then we will close down that angle. And there are a number of different ways that we can use that, either through osteotomies or through tightrope implants. So we'll close down that angle, and then we will loosen the tight tissues on this lateral side of the toe, which pull the toe over, and we will shorten the long tissues on the medial side. So we'll bring the toe back, and then we will secure the soft tissue so that this is in line, and we've restored the normal configuration of the tripod. So all surgeries, almost all surgeries that we do will have some variation of those two techniques, which are combined to correct the deformity. For some deformities which are larger or more significant, we may also do 1 or 2 osteotomies of the bones here more proximal in the foot. So that's also a possibility. And if you have a bunion deformity which is associated with significant osteoarthritis of this joint, we may simply straighten the toe and then fuse this joint so that you have the restoration of the tripod, but you will have that without movement at this joint. So those are the basic techniques with which we treat a bunion deformity and hallux valgus problem.